Singer Preta Gil recently spoke about her surgery experience, revealing that she underwent a procedure called total abdominal hysterectomy to remove a tumor. This surgical process involves the complete removal of the uterus and may also include the removal of the cervix. Dr. Andrea Grieco, a gynecologist and obstetrician, explains that hysterectomy can be categorized as either partial or total, with the distinction being the removal of only the uterus body or both the uterus body and cervix. Gynecologist and obstetrician drive. Larissa Cassiano further explains that in partial hysterectomy, the upper part of the uterus is removed while preserving the cervix. In total hysterectomy, both the upper portion of the uterus and the cervix are removed. This surgical intervention is typically recommended for women facing serious pelvic issues, including advanced cervical cancer, ovarian cancer, infections, fibroids, severe endometriosis, hemorrhages, and uterine prolapse. In certain oncological cases, when pelvic vessels are invaded, doctors might opt for hysterectomy to protect the patient's health, as was potentially the case for Preta Gil. The procedure Preta Gil underwent involved a total abdominal hysterectomy, where both the uterus body and cervix were removed through an incision made in the abdomen. An alternative approach is vaginal hysterectomy, where the uterus is accessed through an incision in the vaginal canal. Additionally, laparoscopic hysterectomy involves small incisions in the navel and vagina for the surgical instruments. One of the primary outcomes of hysterectomy is the inability to conceive, as the uterus is removed. Although menstruation ceases with uterus removal, hormonal balance remains unchanged if the ovaries are left intact. This means that women can continue to experience normal ovulation and hormonal cycles. Dr. Aline Calixto emphasizes that while the uterus is responsible for the endometrial layer where menstrual blood accumulates, its absence doesn't impact hormone production. Partial hysterectomy might still result in cyclical bleeding resembling menstruation due to remnants of the endometrial tissue. There can also be other effects such as changes in libido, lubrication, and discomfort during intercourse. Recovery from hysterectomy, particularly the abdominal approach, is considered complex. Dr. Cassiano notes that the procedure carries an average risk and requires a more intricate recovery due to the larger incision and longer surgery duration. Dr. Calixto mentions that recuperation can involve pain since abdominal procedures can affect daily activities and movements. However, advancements in surgical techniques, like video-assisted or robotic approaches, have contributed to reduced risks and improved recovery outcomes over time. In general, individuals often don't experience significant differences in their overall well-being after a hysterectomy.
Like, comment, share, and subscribe.